First of all, this is a phenomenal group, outstanding conversation. And it really goes to show the research methodology in terms of data, AI, this is all we need in order to really have enough to make a difference. So thank you very much. I only want to say two things. One is on Thursday, April 25th, we'll be having a climate and health day at the National Academies, which is co-hosted with the climate group and also Kaiser. This is the first ever health and climate health day in the United States. It's part of the U.S. Climate Action Summit put together by the climate group that hosts Climate Week every year in September. So needless to say, we're very excited about this. Hope many of you will join by Zoom or come in person. It's going to be at the Keck Building in National Academies. Second, on that day, we are also launching the Accelerating National Movement Initiative. We are going to invite every single health organization to join us to work on climate and health. And we already have hundreds of people signed up already, but we'll be formally launching it on that day. And Don Berwick is helping us because, as you know, he did the 100,000 Lives campaign previously. We're using very much his model of doing this. Just want to make those two comments. Seema may be saying about that too, but I do want to turn over to Seema, who's in fact the person behind Kaiser Permanente, who's been moving so much of this climate initiative at KP, but also a great friend in support of this initiative. Seema, over to you.
Thank you.
Victor, thank you so much. Today has been an incredible day of learning. We've heard from an impressive array of experts passionate about addressing climate change. We've gained insights into the vast and varied health and equity impacts of climate change. All of our amazing panelists helped us take a deeper dive into the biological impacts of climate change, whether that was reproductive health, heat, or epigenetics, the social environmental factors that intersected with climate, and so many other key pieces. Our discussion focused on how we can implement programs to address climate change, health, and equity, and how a climate-savvy healthcare workforce can both support and be supported by climate research. Most critically, we focused on the importance of including community voices and bringing an equity lens to the work we do, all at the intersection of climate and health. As one speaker shared, climate interventions focused on health equity will be the most impactful and longest lasting. We've talked today about how we can collaborate and leverage research to meet the needs of community. Communities need access to reliable, actionable data to help drive climate action in the places they live, work, and play. Researchers want their work to make a difference in the world. The Climate and Health Research Agenda aims to support both the needs and bring communities, researchers, healthcare providers, advocates, policymakers, and leaders, and more together to help drive meaningful changes to protect the health of the planet and communities in a changing climate. Reflecting on the journey we embarked on today, I remember our early conversations with the National Academy of Medicine. It's remarkable to see how far we've come since the inception of the scoping idea, in 2021. The workshop then set the stage for what has unfolded here, where multidisciplinary minds converge to dissect research gaps, showcase innovation, methodologies, and champion evidence-based interventions. It was no accident this webinar was hosted today on Earth Day. At Kaiser Permanente, we believe improving health is more than just providing high-quality health care. Good health starts in our communities and is supported by a healthy environment. Like many on the call today, we at KP at Kaiser Permanente are working to improve the conditions for health and equity in all of our communities by addressing the root causes of health. These improvements grow from our collaboration with communities to co-design and co-create solutions that truly make a positive impact. The insights gleaned from today's discussions will not merely dissipate into the ether, but will be instilled into the collective effort moving forward. They will serve as the building blocks for a robust research agenda, one that prioritizes interdisciplinary collaboration, amplifies evidence-based interventions, and champions health equity in the face of climate change. And while the topic of conversation today can be overwhelming, and climate change is certainly a daunting challenge to address, we hope today's conversation can leave us with a sense of hope. I know I feel more hopeful today at the end of the day than I did at the beginning of the day. As we conclude this convening, I urge each of you to carry forward the spirit of collaboration, innovation, and commitment that has defined our discussions today. Let's redouble our efforts, forging ahead with determination, purpose, and continued action by completing the survey link that has been shared in the chat. We want to hear from a wide variety of perspectives from across our communities, from academia, from the healthcare sector, and beyond. On behalf of Kaiser Permanente and our partners at the National Academy of Medicine, I extend my heartfelt thanks to each and every one of you for joining today's conversation and for your unwavering dedication to this cause. Together, we are not just addressing the challenges posed by climate change on human health and equity, we are shaping a brighter, healthier, and more equitable future for generations to come. Thank you for being part of today's journey.